Caitlin Oliver. I'm going to be doing your physical exam today. Before I start, I'm going to wash my hands. Good. Okay, so what brings you in today?
I have some knee pain in my right knee.
Okay, I'm going to have you start by standing up so I can inspect your lower extremity and feet for any cavus, which I don't see. All right, please sit back down. Now I'm going to inspect the knees for any swelling, asymmetry, deformity, or atrophy, which I also don't see, so that's good. And now I'm going to start by palpating bilaterally the quadriceps tendon, the patella tendon. Feel any pain?
No.
The tibial tuberosity. Now I'm going to do the medial meniscus and MCL bilaterally. Any pain?
No.
Any pain?
No.
And now the LCL and the lateral meniscus bilaterally. Any pain?
Mm-mm.
All right, now I'm going to do the semimembranosus and semitendinosus bilaterally. Any pain?
No.
And then the biceps femoris bilaterally. Any pain?
No.
The fibular head and the pes anisi bilaterally. Any pain there?
No.
All right, now we're going to do some range of motion testing. So your knees are flexed. Can you go like this? You feel any pain with either one?
No.
And now can you hyperextend your knee, so straighten it all the way out? Any pain there?
No.
Okay, good. Now we'll do strength testing. So we're going to start with knee flexion. So pull against my hands with your knees. Good. And now push against. Good. And now we're going to do your hip strength. So can you lift your right hip? Good. Up. And now can you lift it and then push down? Good. Good. And now abduction, so spread your legs. Good. And now push. Good. All right, so the strength was good. So now we'll move on to the special tests. So I'm going to start by having you twist around and kind of lean back against that. I might need to jump. Okay, so we're going to start with the valgus test. So if you just like loosen your leg, let it loose. Good. And now I'm going to put valgus pressure on your knee and then feel for your medial meniscus. Good. Do you feel any pain?
No.
And we'll do a varus test on this side as well. Good. So now we're going to do the same thing on the other side. Any pain?
No.
Any pain there? All right, good. Those are both good. So now I'm going to have you sit back up. And now we're going to do the posterior drawer test. So if you'll just put your leg like this. And there's no abnormal posterior movement, so the PCL is intact. And now this. No abnormal movement, so the PCL is intact as well. And if you'll flip back up. Oh, and also for the varus and valgus test, we were testing your medial and lateral collateral ligaments. All right, now moving on to the anterior test, or the Lockman's test to test for your ACL. So have your knees at 90 degrees. And I'm going to stabilize your knee. Pull. There's no abnormal movement, so your ACLs are intact bilaterally, so that's good. And now moving on to the McMurray's test. So this is going to be to test your meniscus. So just let your leg hang loose, and I'm going to internally rotate it and palpate the lateral joint line, and now bring it up. There's no popping or clicking, so the lateral meniscus is intact. So now we'll do this one. I can't reach. So we'll do this way. Here, let me just grab your knee like this and bend. No popping and clicking, so that's good. Medial meniscus is intact. Now we're going to do the same thing. Externally rotate the foot. Bend. Good. Now internally rotate. Good. All right. And lastly, we're going to palpate for any effusions. So I'm going to start by doing the balloon test. So I don't feel any fluid around the patella there. Don't feel any fluid around the patella there. Now we're going to do the ballottement test. I don't feel any fluid. Any pain?
No.
Good. I don't feel any fluid. All right. So now lastly, we're going to do the fluid displacement test. I'm gonna make sure the skin's taut. I don't see any abnormal fluid movement. Do this side as well. Good. Good. All right, good. So your knee exam looked pretty good. So now we're gonna move on to the hip exam. So I'm gonna have you stand up and go there, and I'm gonna inspect your gait. So walk towards me. Good. Now turn around and walk the other way. Good. All right, and then I would also inspect for any atrophy of the hip. So could you please sit back down? Actually lay down. And now I'm gonna have you lay over on one side so I can palpate your tracheal bursa. So I'm just gonna, sorry. All right, now flip sides. I'm gonna palpate the other side. Just gotta make sure there's no bursa, or no bursitis there. Good. All right, now lay back on your back. Okay, so now we're gonna do some passive range of motion of the hip. So just let your leg completely hang loose, and I'm gonna do all of it. So we'll do flexion, and now can you scoot over so I can extend your hip off the side of the table? Extension, any pain?
No.
And then we're gonna do abduction and adduction, and then bend your knee please, and now external rotation and internal rotation. Any pain with any of that?
Nope.
All right, good. So now we're gonna do the Faber test. So if you could scoot to the middle of the table, I'm gonna have this leg bend and create like a figure 4 right there, and then I'm gonna gently push down on the knee, and I'm testing for any do you have any pain there?
No.
Okay. I'm testing for the sacroiliac joint with the Faber test, and then any pathology of the hip and the sacrum. And then lastly for the hip, I'm gonna do the Ober's test. So you're gonna need to lay on one side again, that way. And I'm gonna bend this knee, not all the way, and then lay completely on your side. And then extend and let this one drop. You feel any pain there?
Nope.
Okay, a positive test would be if your leg relaxed towards the table, so that's a good thing. And now lastly, I'm going to inspect your ankles so you can sit back up. And I'm going to inspect for any swelling, deformity, atrophy of the ankles, so that looks pretty good. And now I'm going to palpate, here you have to come down to this. I'll have to palpate the medial malleolus, the deltoid ligament, the lateral malleolus, the lateral ligaments, your anterior ankle joints. Do you feel any pain?
No.
Your Achilles, your plantar fascia, your tarsals, your metatarsals, the MTP joints of your feet, and your phalanges. Do you feel any pain in any of there?
No.
All right, and now we're gonna do the range of motion in your ankle, so we'll have to come back down. Inversion, eversion, plantar flexion, and dorsiflexion. So that was all passive. Now can you do it active? So you do it, inversion, eversion, plantar flexion, and dorsiflexion. Good. Any pain with any of that?
No.
All right, good. So now I'm gonna have you flip around and lay down on your stomach and let your feet hang off the table. I'm gonna do the Thompson's test, which is testing for your Achilles tendon. So I'm gonna squeeze your calf. Okay, good. There was movement in your foot. That was supposed to happen. Because if there's no movement, that could indicate an Achilles tendon tear. So now could you sit back up, please? Sorry, there's a lot of movement. And we're gonna do the Mulder's test, testing for Morton's neuroma. So I'm gonna squeeze your feet right here, palpate the third and fourth. Any pain?
No.
No clicking, so negative for Morton's neuroma. And now the calcaneal squeeze test for any stress fracture or plantar fascia or fasciitis. So I'm gonna squeeze. You feel any pain?
No.
On the inside or the outside?
No.
Okay, so it's negative for stress fracture and for plantar fasciitis. And lastly, I'm gonna do the anterior jaw test to test for a lateral ankle sprain. So and I don't feel any laxity, and you don't have any ankle pain, right?
No.
Good. And then lastly, I'll do your dorsalis pedis pulses bilaterally and your posterior tibialis pulses bilaterally. Good. That's the end.
Okay.